We are changing a CVAD dressing today. So before I enter the patient's room, I'll check for doctor's order, make sure that the order is appropriate and it is a good time to change the dressing. And I would gather all my supplies and bring them into the room with me, put them on the side table, and I would knock on the door and knock. Hi there, my name is Tia. I'm a student nurse at St. Martin's University. I am here to do a dressing change for you. Would now be a good time? Okay. Before we get started, can I have you verify your name and date of birth? Perfect, and that matches what I have in the MR. And then before we get started, I know you have an allergy to penicillin, but do you have an allergy to any antimicrobial agents, any latex or adhesives? No? Okay, that also matches what I have. So I'm gonna raise the head up while I'm doing that. You've had this dressing changed previously, correct? Okay, and that time went okay? Any pain or discomfort during that dressing change? Okay, and you do consent to us changing it for you again right now? Perfect. All right. So I'm just going to bring my table and garbage can over within arm's reach. Going to do hand hygiene. Going to put this down before I do hand hygiene. Put that down. I'm going to put a mask on my patient. So I do need you to wear a mask during this procedure, and that's just to hopefully keep the sterile procedure as sterile as possible. I am also going to ask that you turn your head away from your dressing site and keep it that way while we do this. I'm going to put a mask on myself. Then I'm going to perform hand hygiene and put on some gloves. All right, if the patient has an IV running, I would turn it off at this point. All right, first thing we're gonna do is just pull your gown down just enough for me to be able to visualize what I'm doing. And just take a quick look. So I don't see any redness or irritation. All right, and then I'm gonna go ahead and just touch really quick. Let me know if you feel any pain or tenderness or discomfort. No? Okay. No nodules or lumps felt. All right. And just make sure that both of these are clamped before we get started. All right. And then I'm going to go ahead and get started if you're ready. So I'm going to hold on to the catheter so it doesn't become dislodged. And then we're going to take the old dressing off. It's very sticky. There we go. Doing okay? Okay. Keep breathing. We are almost done. Perfect. All right. And then once that's off, I can go ahead and look at it without the dressing. Still no redness or irritation noted. I do see that 2 sutures are holding the catheter in place. I'm going to take my gloves off and perform hand hygiene again. All right. I'm going to open my sterile kit and also my sterile gloves. So we don't overlap sterile fields here. Dominant hand first. Dominant hand. Oh, we're going to pretend like that didn't happen because it's still, my hand is still covered. Okay, don't want to touch my sterile fields. I'm going to use my foot. Keep my hands up above. So, first thing we're going to do is take an antimicrobial wipe. And we're going to clean around the area. And this is just going to take off any dried blood or discharge that may have come out from the catheter during its previous placement. We're going to do chlorhexidine. So you'll hear a snap, snap. And then I'm going to clean the area all the way around in a back and forth motion, making sure not to wipe or blot. I'm going to do this for 30 seconds. And once that 30 seconds is up, we're going to allow this to completely air dry. That goes in the garbage. So take a moment to just let that dry completely. And we're going to grab a skin protectant. And this just allows the new dressing that we're going to put on. It's just going to make sure that it stays on nice and sticky where we need it. Garbage. Okay. Oh, gonna grab that guy. Peel that off, throw it away. Gonna place this new one over the top. Make sure that the seal around to the new seal is good. Tear the strip away. Make sure that that new one adheres all the way around. That we get a good seal all the way around it. Perfect. I'm going to hold on to that because I do need that. Okay. Now I am going to change the caps on the ends. So I'm going to make sure both of these are clamped first, one lumen at a time. I'm going to remove the old. There we go. That goes in the garbage. Grab a new one. Oh, can I have my CNA get me 2 sterile flushes, please? I don't have any flushes. It's the only thing I forgot. Okay, while we're waiting for those flushes, I'm gonna go ahead and scrub this lumen. Thank you so much. Make sure we scrub the lumen very well. Perfect. I'm gonna take a new end cap. And attach. Make sure we prime so there's no air. Perfect. I'm gonna attach that. We're gonna instill 3 mLs. Oh, first I have to unclamp. Instill 3 mLs. And we're gonna pull back and look for a flash. We got. And we're gonna instill short bursts of 1 ml over 1 minute for a total of 10 mLs. Perfect. We're going to reclamp and remove. And then if I had an antibacterial cap, I would put it on at this time. Then we're going to repeat the same procedure for the other. First removing the old cap, making sure that it's clamped first. Oh, clean it with an alcohol swab. Very well. That's how you know it's cleaning well, if it makes that nice squeaky sound. All right. Grab our other cap here. Again, prime it so we make sure no air is going in. Touch. Instill 3 mLs initially. Oh, again, unclamp it first. And pull back and check for a blood flash, which we got. And then we would do the same procedure. Short bursts of 1 ml over 1 minute until we have reached 0. Doing this just checks for patency of both lines to make sure that there's no clogs. Perfect. Reclamp. And again, if I had an antimicrobial, I would put that on there right there. All right, so then I would remove my gloves, perform hand hygiene, Gonna go ahead and remove your mask because we're done with the sterile portion. Oh, sorry, that got back behind there. Gonna put your drape back over you. Okay, do you have any questions or concerns as far as pain or anything? Great. So make sure that you have your call light. I would clean up all of my garbage. Oh, I have to put this on here. So I would initial date and time when I applied, so that the next nurse knows when this was applied and when it is due to be changed again. I apologize, I almost forgot that part. Put that on there. Put your gown back on. And put your side foot back up. Again, your gall light is right here in your hand. Let me know if you need anything. And put your bed back down into a safe level for you. Would you like the head of your bed raised at all? No, you're good laying down? Okay. And then, so just a quick couple things that I want you to remember. You didn't have any pain or discomfort in that area before, and you should not again now that we've changed it again. Please let us know right away if you do. You should not see any blood or drainage coming from underneath that, and if you do, please let us know that right away as well. And again, I'm going to clean up my mask. And I'll leave the patient's room. I will fill out a document, date, site, and time. And then any adverse reactions that the patient had, I would say the patient tolerated it well, no reports of pain. I would also say no redness or erythema, swelling, any signs of infection. Patient teaching was provided, and the patient did not have any questions.